Good morning, Ms. Smith.
Good morning.
My name is Aaron Corsari, and I'm a dietitian in training, and I'm here to perform a nutrition assessment. Do I have your permission to record this session?
Yes, you do.
Great.
No problem.
So the nutrition assessment includes a physical exam in which I need to touch and palpitate different parts of your body, including your face, your arms, your back, and your shoulders. Are you comfortable with me performing this exam today?
Yes, I am. No problem.
Okay, great, thank you. And are there any sensitive areas that I should be aware of?
Nope. I think nothing too sensitive. No.
Okay, good. I'm going to ask you just a few questions before we begin.
Mhm.
Have you had any unintended weight loss or weight gain lately?
Nope. I've been maintaining pretty well, I think.
Maintaining, that's good. And how has your appetite been?
It's been good. Normal, I would say.
Normal,
Mhm.
okay. And have you had any changes in your eating habits lately?
Nope. Not lately. Just maintaining. Mhm.
Okay, good. And any noticeable loss of strength, like when you're opening a container of food?
Nope. Nope. I think I've been fine with that. Mhm.
Okay, great. So before we begin the physical, I'm going to wash my hands and put on gloves for your safety.
Okay.
I'm simulating thoroughly washing my hands for hand hygiene. I'm using soap and warm water, and I'm not wearing any jewelry. I'm wetting my hands first, and now I'm going to apply about 5 milliliters of soap. I'm lathering the soap and scrubbing my hands in a circular motion for about 20 seconds, and then I'll scrub my wrist, my thumbs, my fingers, each finger, and the back of my hand. After rinsing, I'm going to dry my hands with a paper towel. And now I'm going to apply my gloves. I'm going to be examining you for subcutaneous fat loss, muscle wasting, fluid status, and any vitamin and mineral deficiencies.
All right.
All right. Now I'm going to check your hair for texture, any thinning, and if your hair is easily pluckable.
Okay.
Easily pluckable hair may indicate protein or essential fatty acid deficiencies.
I see.
Have you noticed any changes in the way your hair feels lately?
Nope. I think it's been feeling pretty normal, pretty strong.
Okay. And does your hair ever fall out?
No, not really. Just kind of maybe a few hairs in the shower or brushing my hair, things like that.
Sounds good. May I touch your hair?
Sure, no problem.
Great. Just feeling the texture. Seeing if it's pluckable. Okay, that feels normal.
Good.
Next, I'm going to palpitate your temporalis muscle on your temples to look for any depressions or muscle wasting. Okay, is it okay if I touch your face?
Sure.
Great. Okay, I don't feel any depressions. That's good. All right. Next, I'm going to examine your orbital region around your eyes, and it doesn't look like there's any dark circles, so that's good. And I'm going to palpitate the bony ridge under your eyes. And the brow bone, check for any hollowing. And now I'm going to check the buccal fat pad below your cheekbones for any sunken depressions. That feels totally normal. Okay, so have you had any changes in your vision or any problems seeing at night?
Nope, no problem.
Okay, good. I'm going to shine my flashlight in your eyes to check for conjunctiva and sclera of the eyes and for any discoloration or abnormality. Pale conjunctiva could be a sign of anemia. So could you please look to the left and pull your eyelid down on your right eye?
Sure. This one?
Yes.
Okay.
Thank you. I'm also looking for spots, which could be a sign of vitamin A deficiency. That looks totally clear.
Great.
Next, I'm going to examine your lips for cracks or lesions. Have you had any oral problems lately, such as problems chewing or swallowing?
Yeah, not really any problems. I did go to the dentist recently and got a deep cleaning, but I think it's healed since then.
A deep cleaning, okay, that's
Yeah.
good. And have you had any problems with dry mouth or changes in taste?
Nope. I've been all good there.
Okay, great. So next I'm going to check your teeth, tongue, and gums for bleeding or abnormalities. I'm also going to check your gums for gingivitis, which could be a sign of vitamin C deficiency. So could you please open your mouth and say ah? Great, thank you. Can you just lift your tongue? Perfect. And now, can you just pull your bottom lip down so I can check your gums for gingivitis? Looking for any redness, swollenness, and that looks totally normal.
Great.
Thank you.
You're welcome.
Now I'm going to palpitate above and below the clavicle bone to look for muscle loss.
Okay.
Okay, can I touch right here?
Yes, that's fine.
Above your clavicle bone.
Mhm.
I'm looking for any muscle loss or fat loss.
Mhm.
And I'm seeing if I can slide my fingers under your clavicle bone. That feels normal.
Okay.
Next, I'm going to feel your acromion process, which is on your shoulder. So would you mind just lifting your right sleeve up?
All right.
Great, thank you.
Like that?
Mhm. Visually, I don't see your acromion process, which is good. It's not protruding. And I'm just going to palpitate it. That feels normal. Next, I'm going to test the turgor of your skin for hydration status.
Okay.
So I'm going to pinch your skin on your sternum, just below your neck. Is that okay?
Sure, that's fine.
Okay, great. Just lift your shirt down a little bit.
Sure.
Perfect.
Okay.
Just like that.
Okay.
Okay, that feels normal. Now, could you please put your hand against mine and push straight out?
Sure. Like that?
Just like that. Perfect. I'm checking around the muscle groups around your scapula for fat loss or muscle wasting. Feels normal. And can you please put your arm at a 90-degree angle? Just like that. Good, and relax. I'm going to grab your tricep, and I'm going to pinch the fat, separating it from the muscle, to see if the skin is loose or for signs of fat loss. Feels normal. Okay, and now I'm going to palpitate your interosseous muscle on your hand, between your thumb and your first finger. And can you make an OK sign for me?
Okay.
Good. That feels normal. And now could you just turn your hand around and cup your hand like you're gonna grab a ball.
Okay.
Just like
Like
that,
that?
yes.
Great.
I'm gonna feel your thenar muscle in between your thumb and your wrist. I'm looking for fullness of the muscle, and this feels like a nice full thenar muscle.
All right.
Perfect, thank you.
You're welcome.
So next I'm gonna examine your fingernails. Have you noticed any change or broken fingernails?
No, not really. I think they're strong.
Great. Can I see your hand?
Sure.
Perfect. I'm just looking at the shape and the appearance of your fingernails. I'm also looking for Bowes lines or cracks in the nails, which could indicate a zinc or protein deficiency. Okay, that looks normal. And next, I'm going to test your fingernails for a capillary refill, which is a hydration test.
Okay.
Can I please see your other hand?
Oh, sure.
Okay, that looks totally normal.
Awesome.
Okay, so that completes our exam today, and I'll make sure to follow up with the doctor.
All right. Thank you so much, Mr. Corsari.
Thank you.